guys. Now we're on pathology. Today we're going to get through the benign tumors. The malignant, as you guys have read, there's plenty of benign tumors, right?
Yeah.
From cystic to solid lesions. There's plenty of them. Okay? But we're going to get through those today. And we're going to do malignancies. If you actually read and did your outline, you know it's not as many malignancies as there are benign tumors. So we're going to bang out malignancies and the rest of the chapter in the next class. Okay. So again, today benign, Friday malignancies, the rest of the chapter. Monday, I love the fact that it got pushed back, and now you have the weekend to study. It's like having an extra 2 days, other than just taking the last lecture on Wednesday, then taking the test Friday. Instead, now you have an extra basically 3 days to do some studying. All right. So with that being said, guys, benign lesions, and of course, ultrasound is very useful in determining whether a mass is going to be cystic or solid. I advise you guys to take notes because I did try to break it down into a simpler format. Okay. So again, determining whether a mass is cystic or solid is the first step that an ultrasound technologist must do when they're evaluating breast. Okay. Classifying simple cysts is relatively easy. You know what a simple cyst looks like? It's a thin walled, round or oval shaped structure that's anechoic, right? No internal echoes, right? But however, when uncertainty comes when the fluid or when that cyst is complex or I forgot the other word. We'll get to it. Okay? So something that makes cyst complex could either be any kind of debris within that cyst, hemorrhage, or infection. Okay? A lot of times you can't eyeball and just say, oh yeah, that's a hemorrhage. Oh yeah, that's infection. You know that based on them getting a sample from it. Or like in my case, if you have to do a breast ultrasound and somebody's abscess bust open on you, then you know that that's an infection. Okay? And it's all green and stuff. Okay? If it comes out in this blood and it's thick in blood, you know it's hemorrhage. Okay? So when it comes to like those complex and those complicated cysts, then additional workup needs to be done to determine if that cyst is either benign or malignant. So the only way you can tell if it's benign is if it's simple cyst. Simple cyst will be benign. But if it has any kind of internal echoes, debris, anything like that, there's a chance that it could be malignant. Any kind of solid structure within there, it's a chance that it could be malignant. Okay, so guys, a simple cyst. I feel like I gotta get on my head with a mosquito or something. A simple cyst. Again, just like any cyst, a true cyst, they're lined with the epithelial cells and their fluid-filled masses, lined with epithelial cells that make up that tissue. So those whatever cells that make up that tissue, that's what a true cyst is going to be lined with. Okay. Most breast cysts are related to fibrocystic chains (FCC) and develop over time from progressive dilation of small ducts within the obstructed TDLU. You got translobar, transductal lobular units. Okay. The most common cause of breast lumps in women, 35 to 50, are from cysts, and uncommon in elderly women. Okay. In young and elderly women. I'm sorry. Uncommon in young and elderly women. Okay. Cysts, they can be single or multiple, and with time, most cysts regress and involute or go away, pretty much. Right. So, some simple cyst signs and symptoms. Sonographer features would be smaller flaccid cysts are usually asymptomatic, meaning that you don't know that they're there. Okay? These are my signs and symptoms. Tense or enlarging cysts are palpable and may be tender, and most cysts are compressible unless they're tense. Okay, meaning they're compressible. You can squeeze them, and they can, you can feel them not have much resistance against you. Okay? So again, I know the book goes into technical considerations versus every single pathology, right? Most important thing I want you to know about the technical consideration is always try to optimize your images, right? There's many ways to optimize your images: angling your tube, angling your probe, using spatial compounding, using whatever technical factors you have to use to optimize your images as far as like if it's a say it's a hemorrhage, right? Hemorrhage can also have that appearance of sludge. Sludge is those really light echoes. So don't just automatically press harmonics, and get rid of those light echoes because they may be true. Okay, so definitely evaluate that breast thoroughly to make sure are those internal echoes within the cyst, are they true or are they not? Okay, and here's just an image of the breast pathology right here, or a simple cyst right here, guys. So again, this is the mammogram. This is what a simple cyst would look like on a mammogram, correct, Pat? Mm-hmm. Well circumscribed mass. That's what's it called? Sonolucent. Sonolucent, right? Is that sonolucent? I mean, not sono. Radiolucent. Radiolucent, meaning it's white. Radio dense meaning it's black. My fault. I'm stuck in my ultrasound world. Radiolucent. Okay? But an ultrasound is going to have that similar. I mean, it's going to still be well circumscribed, thin walls, and no internal echoes. With you see, guys, the acoustic enhancement posterior to the cyst.
Through transmission.
That's like a telltale sign of a simple cyst. Yes, sir.
It's through transmission.
Yeah, through transmission. Through transmission. Absolutely. Meaning that because it's a fluid filled structure, we know that sound is going to travel faster through it. Correct? Okay? So those are some of our cysts right there, guys. Fibrocystic change, actually it's the most common benign diffuse breast condition. Fibrocystic change is no longer considered a disease, but rather signifies several changes. Okay? With aging and hormonal imbalance helps induce these changes that affect ducts, lobes, and connective tissue. Okay? Taking those, guys, this is what these are my summarizations right here. Okay. Some key features of fibrocystic change include epithelial hyperplasia, adenosis, stromal fibrosis, meaning the tissue outside of the TDLUs, that's the stromal, and fibrosis, meaning it's getting enlarged, and cyst formation. Okay? Most fibrocystic change findings do not increase cancer risk. Okay? So fibrocystic change is a normal change in the woman's body as they get older, and hormonal changes. Some signs and symptoms of fibrocystic change. At least 50% of women develop symptoms related to fibrocystic change. I know I used to hear my mom, I used to hear people, my aunts. I got 7 aunts, guys, so I was raised around a lot of women. So I used to hear these complaints, right? And so these symptoms are breast tenderness and pain, fullness and nodularity, and nipple discharge may be present, and usually bilateral, and increase around menstruation and diminish after menopause. Okay, so you would always know when it's mom's time of the month that she'll be complaining about stuff like this. All right. So the nipple discharge, guys, it may be like green or yellow, depending on the materials that make it up.
So the last line for the usually bilateral and increase with it's the pain or the discharge increase bilateral.
Mostly that was talking about the pain and the tenderness. That's going to increase upon the onset of
not the size.
menses. Right. That's going to increase a lot when menses comes. Some sonographic features of fibrocystic change. The most common sonographic feature is bilateral presence of multiple breast cysts of varying sizes. You see like a chain of breast cysts. Clustered microcysts may have a hyperechoic foci. Remember like that? Remember like the colloid cyst of the thyroid? How it has that echogenic like dot in the middle of it? That's what milk of calcium or hyperechoic foci. That's what it's going to look like on a breast cyst. Okay. Stromal fibrosis can increase the echogenicity of the mammary layer. Some other sonographic features is the basket weave appearance and ductal prominence is present. You may see some dilation of the ducts. Nodular adenosis may appear as a circumscribed mass. Sclerosing adenosis has an irregular shape. Microlobulation or microcalcifications make it difficult to determine it from cancer. And here goes that little chain of cysts right there of varying sizes right there on this breast. So let's talk about, now that we talked about fibrocystic change and simple cysts, let's talk about complex cysts versus complicated cysts. Okay? So complicated cysts are, they're still fluid, they still have fluid in it. Okay? Complex cysts consider something that has a solid structure within it. Okay? So complicated cysts, they're going to be thin wall cysts containing homogeneous low level internal echoes. Like I said, remember talking about that hemorrhage. You have a hemorrhage in the breast, then it may have those low level internal echoes within it. Okay? Mobile internal echoes, meaning that if you have the patient turn to the cube or if you move the breast to a certain angle, you're going to see that fluid level change. Okay? Fluid debris level again, fat fluid level, and no complex features. Meaning you're going to have the hypoechoic on the anterior part of the cyst, and it's going to be the low level echoes posterior, right? Depending on the patient position, okay? Because he's going to work by gravity. Okay, the complex fluid is going to be on the dependent side of the body, okay? Because it's heavy. All right. So inflamed or infected cysts, they're thick walls, thick isoechoic walls. Hyperemia of the wall confirmed by the Doppler, meaning that when you put the color Doppler on, you're going to see vascularity within that wall. Okay, and you also still going to see fluid debris levels. Okay, with the inflamed infected cyst. And complex cysts are lesions to think of suspicious findings. Okay, they're going to have a thick wall that's greater than 0.5 millimeters. And thick septations that's greater than 0.5 millimeters, and it's considered having an intracystic mass, meaning that it's a solid structure within this cyst. Okay, not something that is still on a fluid level like a complicated cyst. Got it? And also you're gonna have mixed solid and cystic components, like I just said. Okay, so everybody know the difference between complicated versus complex. Complicated meaning it's still fluid consistent. Okay, maybe thick and fluid like blood or some kind of debris. However, complex cyst is going to have a mixed cystic and solid appearance. Okay. There's some images right here, guys. You see our complicated cyst. All of these, you can actually see this sometimes kind of moving, like it's falling down, like it's rain or snow or something like that in those cysts like this. Okay. This is also you see the clear line between the debris versus the fluid, and here's a fluid level right here, guys. You see that fluid leveling off, and you have the whatever thickened blood, whatever hemorrhage, whatever that could be, and you have the plain fluid right here. So these are complicated cysts, still consisting of fluid. Still consisting of fluid, and thickened fluid. Okay? Thin walls. See how you can't see those walls very clear, they're not very echogenic. Well, right here, we have a complex cyst, guys. You see how the wall is thickened? You see how we have that bright echogenic wall compared to this wall right here? This wall, you almost don't see the difference. You don't see that clear delineation of that wall in the complicated cyst, but in the complex cyst, you see it clearly. And you see that this structure right here within, that's not a system, that's not a fluid structure. That's actually a solid structure within that cyst. That's what makes it complex. Yes, ma'am.
So the complicated cyst is older or take after a while it was cyst, then become complicated cyst. What about the complex?
Well, I wouldn't say complicated cyst wasn't always, it may not have been just a regular cyst at first. Like if you have blunt trauma, like if you, I don't know, like some, ran into a wall or something like that, or get in a car accident, that can cause you to have a hemorrhage in the breast. That's going to cause a complex cyst. It won't